Let us discuss about penicillin G. Penicillin G is an antibiotic. It is an antibiotic. It acts by inhibiting cell wall synthesis. Inhibits cell wall synthesis of bacteria. Cell wall synthesis of bacteria. It is a bacteria and it is a narrow spectrum antibiotic. It acts against gram positive bacteria and some gram negative bacteria, and anaerobic bacteria. It is an antibiotic. It inhibits cell wall synthesis and it's a narrow spectrum antibiotic. It acts against gram positive organisms and some gram negative organisms and anaerobic bacteria. If you take the susceptible cocci, it acts against streptococci. It acts against all streptococci except streptococci viridans and group D streptococci. All cocci are susceptible to penicillin G except streptococcus viridans and streptococcus and group D streptococci and Neisseria gonorrhea and Neisseria meningitis. These are the cocci that are susceptible to penicillin G. Next, coming to bacilli. And among gram positive bacilli, we have Bacillus anthracis, Corynebacterium diphtheria. We have Corynebacterium diphtheria, all Clostridium species, and Listeria, and last one is these are the gram positive, gram negative cocci that are susceptible. These are gram positive bacilli that are susceptible to Bacillus anthracis, Corynebacterium diphtheria, all Clostridia, Listeria, and Spirochetes. Okay, these are the gram positive bacilli that are susceptible to penicillin G. Then coming to gram negative bacilli, and among this gram negative bacilli, the gram negative bacilli are not mentioned, and these are gram positive bacilli that are susceptible to penicillin G. Coming to resistance, some bacteria, they are inherently resistant to penicillin. Some bacteria, they are inherently resistant. This resistance is because this penicillin binding protein and target enzymes of penicillin, these are present in the deeper structures. So when this penicillin binding protein and target enzymes are present in the deeper structure, this penicillin G will not penetrate and interact with this penicillin binding protein and target enzymes. This is the mechanism in some bacteria, and the main mechanism is production of penicillinase. What this penicillinase does is it breaks down the beta-lactam ring. It breaks down the beta-lactam ring. Okay, it breaks down the beta-lactam ring. It breaks down beta-lactam ring. So this beta-lactam ring is present in the structure of penicillin G. So this penicillinase, it breaks down this beta-lactam ring and it activates the penicillin G. And this penicillinase is present in certain bacteria. Example, Bacillus staphylococci, Bacillus subtilis, E. coli, Haemophilus influenza, and few other bacteria, few other strains of gonorrhea. Okay, in all this, penicillinase enzyme is present. And coming next important mechanism of resistance is this mechanism is it destroys the penicillin G. But next one is penicillin tolerance. So, what is this penicillin tolerant? Penicillin tolerance means there may be decrease in affinity of bacteria towards penicillin G. This usually takes place in MRSA. MRSA means methicillin resistant Staphylococcus aureus. Okay, methicillin resistant Staphylococcus aureus. And one more mechanism is some penicillin resistant pneumococci and enterococci. They have altered penicillin binding protein. Okay, altered penicillin binding protein is another most important mechanism. This takes place in pneumococci and enterococci. And one more mechanism is Some gram-negative bacteria become resistant by loss of or alternation of pouring channels. Okay, alteration of pouring channel. Alteration of pouring channel. What are these pouring channels? These pouring channels are the channels present in the bacterial cell through which this penicillin G enters the bacteria. When there is alternation of pouring channels, this penicillin G will not enter the bacteria, and this usually takes place in gram-negative organisms. Gram-negative organisms. This is about resistance. Coming to pharmacokinetics, if take pharmacokinetics of penicillin G, it is ß-lactamase. Okay, ß-lactamase. Hence, oral bioavailability is very less than one third is observed. Okay, if take intramuscular, it is very fast and rapid, and it's complete absorption will take place. This penicillin G is usually distributed extracellularly. It is 60% for plasma binding, 60% it is bound to plasma proteins. It is cannot penetrate blood-brain barrier. Okay, but in meningitis, some other infections, it can cross. Okay, usually this does not cross blood-brain barrier, but in certain meningitis infection it can cross. It can also cannot cross serous cavities. Okay, it cannot enter serous cavities, but in sinusitis, in certain synovitis, it can enter serous cavities. Okay, and if take excretion, rapid excretion will take place. Excretion is, before going to excretion, metabolism. If take metabolism, little metabolism in liver, this and remaining is excreted through urine. In the kidney, it is, if take excretion, 10% is, this excretion is very rapid. Okay, 10% is by glomerular filtration, and 90% is by secretion in the tubules. 90% is by secretion in the tubule, 10% in the glomerular filtration. See, in children or in the neonates, this secretory function is not well developed. So the dose must be reduced in children. And probensic inhibit the secretion of this penicillin G in the tubules. Hence, dose should be reduced when using probensin. Okay, and this is about coming to adverse effects. Local irritacy and direct toxicity. See, you remember, this penicillin G is one of the non-toxic drug, one of the most non-toxic antibiotic, The adverse effects are very less. See, if take on giving orally, it causes vomiting, nausea and vomiting, and oral use, nausea and vomiting. Intramuscularly, very painful. IV insertion, it causes thrombophlebitis, and toxicity to brain. This toxicity to brain, it occurs at high doses, and this is manifested as mental confusion, muscle twitchings, convulsions, and coma. And this penicillin G increases bleeding tendency. Okay, this increases bleeding tendency because it interferes with platelet function. It interferes with platelet function, thereby causing bleeding tendency. Then intrathecal injection is contrary. An intrathecal injection, actually it is not used nowadays because this intrathecal injection, it caused arachidinitis and degenerative changes in the spinal cord. Due to these two reasons, these arachidinitis and degenerative changes in the spinal cord, which are caused due to penicillin G, intrathecal injection is not used nowadays. And hypersensitivity, this is most important. This is very most important side effects, because of which this is the most important side effect, because if the patient is hypersensitive, allergic to penicillin G, we have to terminate the drug. There is no other way. Okay, allergic, if take this hypersensitivity or allergy is more common when infused parentally. Okay, when we infuse parentally, this hypersensitivity allergy is very more. Okay, and after penicillin improves, and this it is unpredictable. This hypersensitivity is unpredictable, because even patients who are not hypersensitive or not allergic before prior infusions can develop hypersensitivity, and when we infuse now. Okay, patients who haven't developed hypersensitivity or allergic before can now develop hypersensitivity. Okay, this is unpredictable, because patients who are not hypersensitive can develop can develop allergic now. And there are partial cross sensitivity between different types of penicillins. Cross sensitivity between different penicillins. Okay, because of this, if the person is sensitive to other penicillins, can develop hypersensitivity to penicillin G. And one more thing is that this penicillin G, it acts as aptan, thereby producing antibodies. Okay, it can produce antibodies. And topical application, it is highly sensitizing. Topical application is highly sensitizing. It has that is the reason it has banned to use topically, but except for gonorrhea and ophthalmitis, except for gonococcal ophthalmia, gonococcal ophthalmia. It is used only for this gonococcal ophthalmia as topical ointment, as topical. Remaining topical applications are banned because it is highly sensitizing. It can manifest as dermatitis, other reactions as dermatitis. It can manifest as dermatitis. And super infections usually do not cause any super infection. And one more thing is that, very important, Jarix-Exheimer reaction. Jarix-Exheimer reaction. This is very important. What happens here is that when penicillin G is used in syphilitic patient, suppose we are using penicillin G for syphilitic patient, this what happens is, when we use penicillin G, this syphilitic treponema are breakdown. Okay, there will be breakdown of the bacilli and the bacteria. The breakdown products, they causes shivering. Fever, myalgia, and exacerbation of lesions. Even vascular collapse also can occur. And actually this condition is self-limiting. It can go within 12 to 72 hours. Within 12 to 72 hours, it is self-limiting within 12 to 72 hours. No need of any intervention, but we can use treatment. Like aspirin and sedatives. Okay, and sedatives. These two we can use as treatment for symptomatic relief. And one more thing is streptococcal infection. In streptococcal infection, we can use this penicillin G. If you take the infections: pharyngitis, otitis media, scarlet fever, rheumatic fever. Okay, if you take the infections in which we are using this penicillin G, pharyngitis, these all caused by streptococcal infections: pharyngitis, scarlet fever, rheumatic fever, and otitis media. In all this, we can use this penicillin G. Okay, for subacute bacterial endocarditis caused by Streptococcus viridans and fecalis, for subacute bacterial endocarditis, we can use IV. We can use intravenously for subacute bacterial endocarditis. And then coming to pneumococcal infection. This is actually penicillin G is not used now for empirical therapy of pneumococcal pneumonia and meningitis, because this is not used nowadays, because many strains have become highly penicillin resistant. However, but penicillin G given 3 to 6 milliunits every 6 hours is the drug of choice if organism is sensitive. Okay, we can use in pneumococcal infection. Even meningococcal infection also we can use it. Meningococcal infections, gonorrhea infections, and next syphilitic infections. And one more thing, diphtheria. We can use in diphtheria. We can also use in tetanus and gas gangrene. gas gangrene. And prophylactically, as prophylaxis, we can use in rheumatic fever, bacterial endocarditis, bacterial endocarditis, agranulocytosis patients, and agranulocytosis patient. In all these conditions, we can use penicillin G as prophylactically. In rheumatic fever, bacterial endocarditis, and agranulocytosis patients, we can use this penicillin G as prophylaxis. Thank you for watching.